Hi, I am Dorien Zwart. I'm a general practitioner from the Netherlands. I work in a general practice in De Beeld, and I also work at the University Medical Center of Utrecht at the Department of General Practice, where, among others, I supervise a portfolio in research in patient safety in primary care. I'm here to talk about patient safety culture. What does it entail? Why is it important? And how can we work on it in general practice? Patient safety culture is about the way we do things around here. It's about values, perceptions, competencies and behavior of individuals and of the group in your practice. It's basically about how do you do the things in your practice. Why is it important? It is important. Patient safety culture is the way we do things around safety issues in our general practice. And with a positive patient safety culture, we know that healthcare outcomes are likely to be better. That's not proven for general practice, but it is for other industries, and it is also for nursing and for hospital care. The safety performance is better, the quality delivered is better, and even the patient health outcomes can be better. What are components of patient safety? Basically, it is about organizational matters, about matters at the front line, so work unit matters, and about interpersonal or individual matters. And examples are, for instance, organizational matter is how much priority is given to patient safety in your practice organization. A work unit matter is how is the teamwork, how do you arrange your communication, for instance. And a personal matter is, do you feel safe to speak up? Are you supporting when things get difficult? Are you giving feedback to each other? Do you help each other to prevent error? Patient safety culture can be assessed in different levels. The most known patient safety culture letter is of Westrom and Diane Parker. She adapted it. You have a pathological level, a reactive level, a calculative level. The generative level is the last one, and I forgot the fourth one. Doesn't matter. It says something about how good are the components of patient safety culture in your practice. But culture is also a bit a fuzzy concept. It is difficult to capture. It's not an entity. It's not something you do, but it's something you share in your practice. So how can you work on it? Well, the most important features of an intervention that improve patient safety is raising awareness and make sure that you have shared knowledge, shared goals, and a shared language on patient safety issues in your practice. I'm here to talk about patient safety culture, and I want to add one other thing is how can you work on patient safety culture in your practice? How can you start improving patient safety culture in your practice? Well, the first thing I think you should do is get some kind of baseline measure. There are a lot of patient safety climate surveys which you can fill out with every member every employee in your practice, and then feed back the results to your team. And that feeding back of the results to your team and reflect on it, I think that is a very, very important part. We in Utrecht we did a study on this, and we found that practices who both measured their safety climate and subsequently did a workshop of only 3.5 hours on what patient safety entails and also what results came out of their patient safety culture survey. When they discussed that with their team and after that made improvement plans, they significantly were better in their safety performance than if they did not do this workshop. Basically, if you want to start improving your patient safety culture, talk about it with your team. Talk about how is the safety culture perceived at this moment, what are the differences, why are different members of your team looking differently to the safety culture, and is there something we should improve and how can we improve that? That's the first step to work on patient safety culture. Other aspects of patient safety culture, other components can be addressed also in a later stage, because I do think that patient safety culture, when it is positive, always needs maintenance. So you have to maintain the safety culture in your practice, and especially GPs, as most of the time you are the leaders of your practice. Leadership in bringing about a positive patient safety culture, but also maintaining a patient safety culture, is majorly important. That was about patient safety culture. Now I can say a little bit about care transitions. I think, but not only I, in general practice or in primary care, care transitions are very challenging. It's one of the patient safety subjects for all care settings, but also for primary care. In Utrecht we are doing research on transitional safety, and we mean by this the safety of the care transitions between primary care and secondary care and back. For this transitional safety, if you want to improve, you also have to measure. So in our study project, which is the TIP project, Transitional Incident Prevention Program, we are exploring what patient safety, transitional safety entails, but we also developed measurement instruments. One of the measurement instruments is about transitional safety culture, which is basically a little bit a difficult concept, because for culture you need a group. A group has his values and perceptions, etc. But we do not have a group between primary and secondary care. We only have a group in primary care and in secondary care, and in between there is basically no group. So can you have a culture? But we thought there is a way we do things around care transitions. So there must be some shared values, and we try to make a safety culture questionnaire for that, and we call it TRACE, Transitional Climate Survey. We validated this survey, and we are now exploring how to use it in discussing and reflecting with groups of GPs and specialists. It's about to be published, and the questionnaire is called TRACE, Transitional Safety Climate Questionnaire. A little bit about patients. What could be the role of patients in ensuring transitional safety? Indeed, patients are the only persons who are always present in the journey between general practice, the hospital and home. So they would be a very good candidate for collaboration in maintaining safety in transitional care. But do patients see that role? We did interviews with patients, and we also did focus groups on these questions with specialists, and we found that it's that for patients it's not very easy to take this role because they do not have always enough insight in the process of care transitions. And the short conclusion is that healthcare providers and patients should work together to make this process much more transparent, so that patients can take their role in maintaining and ensuring transitional patient safety.